While most diseases are caused by bacteria or viruses, sometimes your own defense cells can turn against you. An autoimmune disorder occurs when your body's immune system becomes hyperactive. It then attacks the healthy body tissues by mistake, wreaking havoc on your body. Your body's immune system helps protect you against harmful substances, including bacteria, viruses, and toxins that are foreign to the body. It does so by producing antibodies, which destroy these harmful substances. When you have an autoimmune disorder, your immune system does not distinguish between healthy body tissue and foreign substances. As a result, the body sets off a reaction that destroys the normal tissues. Now that we know what they are, let's look at some of the worst autoimmune disorders you could ever have. By now, we know how to avoid type 2 diabetes. Exercise regularly, maintain a healthy weight, and stick to a nutritious diet. Those with type 1 diabetes, however, don't get much of a say. Normally, the pancreas in our bodies contains cells that produce insulin. This insulin keeps our blood sugar levels in check by converting glucose into energy. Unfortunately, those with type 1 diabetes have an immune system that destroys these cells, thereby decreasing or preventing the production of insulin. Without insulin, the body's glucose is not utilized and chronic spikes in blood sugar levels can occur, potentially leading to blindness, nerve damage, kidney failure, heart disease, stroke, and even death. Graves' disease is an autoimmune disease of the thyroid. It occurs when antibodies induce the thyroid to secrete too much thyroid hormone, which can lead to tremors, red skin, and an irregular heartbeat. Thyroid hormones control how your body uses energy, so they affect nearly every organ in your body, even the way your heart beats. You've probably heard of multiple sclerosis or MS. MS occurs when your immune system attacks your central nervous system, the brain, spinal cord, and optic nerves. So there's no overstating just how severely this disease can impact your life. Multiple tests are required for a diagnosis, and the symptoms can be common, such as muscle spasms, problems with your vision and bladder, and changes in your brain function. As of now, there is no cure, but long-term remission is possible with a combination of medication and rehab. Lupus is another autoimmune disorder that is difficult to diagnose. The most distinctive sign of lupus is a facial rash that resembles the wings of a butterfly unfolding across both cheeks. To make matters worse, no two cases of lupus look the same. Also, it can take years to correctly diagnose lupus because it's a chronic disease that can damage any part of the body. Most people with lupus have a mild case characterized by episodes called flares, when signs and symptoms get worse for a while, then improve or even disappear completely for a time. Rheumatoid arthritis is an autoimmune disorder affecting 1 in 100 people around the world. With rheumatoid arthritis, your immune system mistakenly directs antibodies to the lining of your joints. This causes inflammation and soreness of the tissues between the joints. Chronic inflammation destroys the nearby bones and cartilage, which is the connective tissue that cushions the joints. Its erosion results in severe pain during movement. Over time, it becomes harder to run, walk, bend, or even put weight on your joints. There's no getting around it. Autoimmune disorders are complicated and they are serious. If you're concerned that you may have an autoimmune disorder, see a doctor immediately to begin testing. Even if there is no cure, many can be treated, allowing you to live a happy, healthy life.